Welcome back to another episode from the Optimal Body Podcast. I'm DocJen.
And I'm Dr. Dom.
And today we're talking about patellar tracking issues. So the patella is the kneecap, and we're going to talk about it, whether it gets pulled to the side, whether it's not moving correctly, what that means, does it matter, should you tape it? Let's talk about it.
All right, diving in on another podcast on the knee. So we're going to talk into patellar tracking issues. And we've talked about patellofemoral syndrome before, right?
But we also re-aired it, I believe.
Oh, yeah, we did.
Basically, what patellofemoral syndrome is the front of the knee pain, right? So whether you're getting it when you're walking, squatting, working out, running, go listen to that episode because we did a lot of information on it.
And I think that we just want to talk more specifically about patellar tracking because when people are having this patellofemoral syndrome, I think one of the first thing providers might want to say, or people from the outside who are trying to analyze our movement might want to say is like, oh, your patella is tracking incorrectly, or your patella is tracking laterally or to the outside, and we need to fix that. That's why you're having that knee pain. And we want to dive into if that's actually the case.
Yeah. And what is necessary for us as providers, as physical therapists or clinicians, is that we do provide a diagnosis and a reason why you're having pain. So this is why physical therapists, traditionally are going to look at structures because we need a reason for ourselves and for you, for the insurance company, for everything happening as to why you're having this pain.
Yeah.
And as much as that is important, it could be damaging in terms of the mindset. Well, now my kneecap isn't doing what it's supposed to be doing, right? And so I'm now scared to go do workouts or things that's going to bend my knee, which is walking, because now my kneecap isn't tracking the correct way. So it can add a lot of detrimental signals to the mind when we start putting this kind of language onto a patient. That's why we want to talk about it. I didn't have knee issues going through gymnastics. And I talked about this a little bit on my pain journey story as well. So you can listen back to that podcast. But what I did discover is that I had tracking issues when I got into PT school because of evaluating and assessing the way that our bodies looked and the structure of our bodies and everything. So technically, I have patellar tracking issues.
Yeah, because you have what we would call squinting patella, right? Where your patella look like they're tilting inward a little bit, and then it can almost kind of look like they're squinting, like a squinting eyeball or something at you.
Yeah, like they're like when I stand and straighten my knees, my kneecaps, think of them kind of like coming in and down toward each other. However, if I'm just sitting on the table with my legs extended straight, then it looks like I have the lateral tilt, which that just means that the inside of my kneecap is kind of coming up in the middle, and my kneecap itself, rather than resting like perfectly symmetrical and parallel to the ground, it is pulling to the side.
If we just look at the patella or the kneecap itself, it kind of sits on top of this femur, the big, huge thigh bone. And at the bottom of the femur, there are these condyles. So we get this groove that people say like, oh, that's the groove that the patella is supposed to ride in nice and perfectly. And if it tracks any different way in that groove, or if it's tilting any different way, then it's wrong, right? You just outlined, you have your patella doing some different things, but do you have pain?
I don't. There will be times like if I haven't warmed up properly, or if I haven't been doing a lot of explosive type work and all of a sudden I go do a HIIT workout randomly, or I'm going to do like lunge jumps randomly, or I just start running without having any type of, warm up to my lower body, then sometimes I can feel like a slight twinge of that anterior to the front of my knee pain. But it's momentarily, it doesn't last very long. And I think because I psychologically know that it's not wrong and it's not bad. Like, I did not even wake up my structures around my kneecap to be able to suddenly take on forces. So that's on me for not warming up properly, right? But I know that it's not detrimental bad. And the more that I move, the less that I feel it. So then I continue the workout, and by the end I feel fine.
To what degree should we even worry about addressing these things?
Yeah. Well, I think what is cool, and we'll link it, is the study that showed, we're still trying to even figure out what normal tracking is like. Because if we assessed a ton of quote unquote healthy individuals, which I would consider myself. Yeah. So essentially what we're saying is that we can't necessarily just say that the poor tracking is now affecting my cartilage and that's what's causing pain. So I think that's more of an old school myth that it could be, again, the bursa, there has to be something else that's affecting the fluids within the tissue, that's affecting the inflammation. And then that's how we're kind of starting to feel and elicit that pain response. But your cartilage can also take on a lot of pressure.
Yeah. Our knees are built to handle that. Going upstairs, if we're going upstairs quickly, you're putting 8, 9, 10 times your body weight through your knee.
Is it bad if my kneecap is not tracking perfectly? I think we can find studies that prove both. We can find studies that say, we're looking at the tracking issues and people who have patellofemoral pain syndrome, which is just that front of the kneecap pain, right? They're saying like, oh, well, you don't have as much quad force, or you don't, it looks like your patella might be tracking a little bit differently, where we have other studies that say, we can't really determine where the patella is tracking and how that's even affecting the forces at the knee. So I am a healthy person who is telling you that if you assessed my knee, you would find some tracking issues, 100%. I have all these things around my kneecap that look like it should elicit a lot of pain when I move, but yet I can deep squat past 90 degrees under load and not have any pain.
Yeah, again, so it's more a matter of us assessing the things within our body that may be impacting what's going on at the knee. Are we starting to have pain? Okay, let's realize that we're having pain. Now, what can we change about the whole package that might change how that knee's feeling? Can I change a little bit about what I'm doing down at my foot and ankle? Can I change some hip exercises or hip mobility things that I'm doing before I go on runs? It's about assessing that whole package rather than just scoping and honing in on the knee. And there's a specific ligament called the MPFL, the medial patellofemoral ligament, that is kind of meant to give that patella some medial stability. And that's a ligament that they say will get injured a lot if people have some of these, lateral patellar dislocations or have lateral tracking of the patella. A lot of people will say, oh, that MPFL is lax. Now we need to train the VMO to get it to track more medially. And we just have kind of learned that spot training of the VMO, it's not going to do anything in the composite of your patella tracking during dynamic movements like walking, running, jumping.
Exactly.
It just doesn't translate that way.
No, it's not going to change the structure of where your kneecap is moving. A lot of the exercises look like knee extension type exercises, squeezing a ball, bridge type exercises, squeezing a ball. So things that like kind of activate that inner thigh and the quad at the same time. If you think about that, and ultimately it's not bad.
No.
Right? But we also have to think, okay, how is this movement, extending my knee sitting and squeezing a ball, going to translate to how I'm actually moving on a, during exercise that hurts it, while I'm running, while I'm jumping, while I'm hiking. How is that movement going to translate? And so we just have to make sure that we're actually doing movement that's going to translate to what my goal is, to what I'm getting back to. Because again, training that little VMO is not the answer. It's going to help to strengthen the quad complex, so your whole thigh.
Which can help with knee pain. Having strong quads is one of the things that they say, okay, if you have really strong, able quadriceps, you're less likely to have knee pain later in life. life.
Yeah.
So training your quad could help.
Not a bad idea, right? But we just have to understand that it's not just because I'm pulling my kneecap back into place.
Yeah.
And that's where then we can go into taping. Well, what is taping actually doing? Is taping pulling my knee back into place? How long do I have to tape for? What is actually happening?
Is this helping specifically a lateral structure, a medial structure, or is it just kind of taking advantage of these mechanoreceptors we talk a lot about and putting some compressive force on the knee, putting that tape around there, making our knee feel safe, maybe helping some of those tendons and muscles stay a little more active because they feel that pressure and that feedback. Is that the mechanism we're tapping into here? That's what I would think.
That's what I think too. I mean, just that having that compressive forcing around also is just going to send signals to the brain to allow the brain to know, oh, there's pressure here. I'm supported. I'm safe, right?
Yeah.
So now I feel more comfortable moving, and it's going to reduce some of those pain signals as well. So all we're saying is that it's helping to reduce pain so that we can get people to move better. And understanding that this isn't maybe necessarily what's pulling my knee back into place, so I don't have to rely on it. And I think that's the message that I really want to get across, that if this is going to help to reduce pain for the moment as you start to build back into these exercises, then great, use it.
Yeah.
But continue to know that it's not just pulling your knee back into place and you don't have to rely on it. Eventually, the goal is to do all of these exercises and movements without the tape at all. The thing that's going to help above all is movement. You have to move. If you're going to see someone and you're just passively on a table for them to fix you, it's not doing anything.
Okay, you just need a rest. You need to stop putting force through the knees. That's why you're putting too much force through the knees. So people will say that, oh, you need to avoid deep squats or you need to avoid this type of knee motion. Well, we were just looking at something that showed the peak forces through the knee and how it changes based on what part of the knee you're talking about. The anterior part of the knee feels the most shear, the front part of the knee feels the most shear force when we're in just a little bit of bend, from like 0 to 60. So we're feeling the most shear force and shear pressure in the front of the knee, just with a little bit of bend.
Which would be reducing your squat. So imagine if someone said, don't squat as much.
Yeah.
Well, from 0 to 30, 0 to 60, I'm still putting that pressure right on the front of the knee.
So if you're having the most front or anterior knee pain, then that might be the thing that we don't want to load as much, but we still could get into like a 90-degree wall squat or something, or different exercises that for us may not be aggravating versus that 90-degree wall sit. That's when our quad is the most active. That's when we're feeling the most posterior, forces in the knee. So again, if that's where our issue is, that's flaring up some of our knee pains, maybe those movements are more aggravating for us. So you have to get with somebody who might be able to tease out for you which certain movements, which certain things are aggravating my knee pain or knee symptoms.
If you listen back on our tendinosis podcast, what helps is we need load. So if we're going to avoid load, we're actually avoiding healing. And again, it needs to be in a different way. So maybe I'm putting so much force at my knee excessively because I'm not moving well through my hips. Assess the hips. How's your internal rotation? How's your external rotation? Do you even know what those are?
Yeah.
We need to assess how they're moving. We need to assess what muscles are activating when we're doing a movement, right? It's not just about the glutes. It's also about the quads. It's also about the hamstrings. But when are these, who's not picking up slack here?
How does a squat feel? How does a lunge feel? Just do your basic squats and do an inline lunge and see how you feel like you're activating through the hip, through the knee, and all the way through the ankle. Just do a little bit of an assessment in front of a mirror. One of our favorite things to do with people is get them standing in front of a mirror, have them do some of their own basic movements that they may just not watch themselves do ever. And you can pick out some pretty amazing things about your own movement if you just become a little more observant, a little more critical in how you're assessing the way that you move.
And then how can you do it differently? So say your squat is hurting.
Yeah.
How can you do it differently? Can you move your feet? Can you change the angle of your foot? Can you make it more narrow? Can you make it wider? Can you change the way that your knee looks like it's moving? Maybe it's moving more toward the big toe. Can you make it move more toward the pinky toe? Can you change your position of your chest? Maybe your ankles aren't very mobile, right? Maybe you know that you have really stiff ankles. What if you raise the heels? What does that feel like? What if you slow down the movement? What does that feel like? Like, there's not one way to do it.
Putting your feet very narrow together. Try and do a squat and pay attention to what your knees do. Put your feet shoulder width apart. Try and do a squat. See what your knees, hips, ankles do. Put your feet very wide. Same thing. And just doing those 3 things, you should be able to notice what your knees and hips tend to do or want to do. Then what you said, raise your heels and do the same 3 things again and see if that changes things. And doing that little test should give you some good feedback on how your body operates through 6 different variations of a squat.
Exactly. Know that your structure and how you look in your body and the way that it moves might look different from someone else, and that's okay. And ultimately continuing to move and find what works best for your body and what feels best, because the structure might not change again. So what feels best is possible to obtain. You can still do your goals and reach them. It just might look a little different throughout the journey.
I mean, a lot of us want to do the thing that's easy for us. We want to do the thing that's comfortable for us because that makes us feel good. Doing the thing that's a little bit more difficult for us, feeling okay living into that discomfort and trying to learn how to better navigate it will make us more aware of that in our everyday life. Thanks again for joining another PT Pearl from the Optimal Body Podcast, all about those knees. Hopefully you found some tips on how to do things a little bit better for your own body. As always, leave comments below, questions below, subscribe, come follow us because we have so many more of these PT Pearls coming at you.